Welcome back to the show. We continue more conversations based on your teeth, Namibia, and oral health, which is so important. Now, wisdom teeth in particular are often associated with pain, impaction, infection, and the need for surgical removal, although they are a normal part of human dental development. Now, their development, specifically when we speak about eruption and management, continue to be important topics in dentistry because they can significantly affect, that is, your oral health and the quality of life. With that said, we have invited, that is Dr. Maria Shiveva as well as Dr. Maneria Hawendo in studio. They're both dentists to talk to us about wisdom teeth removal, how it can impact you, what happens if you don't take care, everything that you need to know this morning. Doctors, very nice to have you. Good morning and welcome.
Thank you. Good morning.
How are you?
We're good. How are you?
I can see those pearly whites looking beautiful. Dr. Hawendo, I'm going to start off with you. I mean, we're talking specifically about, wisdom teeth, but also ultimately, oral health and so on. Maybe for some people who might have that question, why are they called wisdom teeth? How smart are they?
Okay, thank you for the question. So wisdom teeth are the last molars that come in your mouth at the back, like there at the back. And they are called wisdom teeth, not necessarily because they give you wisdom. It's just because they come in late at the stage of 17 to 25 years old. And that is when society believes that you are grown and matured and wise.
Okay. So, Dr. Maria, Shiveva, I beg your pardon, why is it always necessary? We seem to find it is very necessary to remove these wisdom teeth.
Okay, thank you very much. It's not always necessary to remove. If the teeth is healthy, well aligned, not causing problems or pain, it's always important for you to leave it because it's important, it's part of functioning in the mouth, especially in all ages. It was very important for eating the hard food. But then now modern diets, they are very soft, so it's not really such an important one like any other teeth.
Okay, yeah. So does it put pressure once they're removed and you don't, for instance, get implants, for example? Not everybody can afford it, you understand? So now it's empty in the back. Does it impact, because now I'm treating with my other teeth predominantly, does it impact the other teeth?
No, it doesn't impact any other teeth and you can as well live without them.
Wonderful, yes. Isn't it? Yeah. Dr. Hawendo, what factors, determine where the wisdom teeth erupt normally, or how close also we want to know, are they to the nerves as well as sinuses? In fact, the other day I went for an x-ray and I could actually see my sinuses on the x-ray. And I don't know whether it was interesting or scary, but talk to us about this as well.
No, I think it was interesting, yeah. So the wisdom teeth, some of them come in normally. It all depends on the genetics mostly, because we inherit the jaw size and also the teeth size from our parents. So let's say, for instance, your father has a smaller jaw and then your mother has bigger teeth. So now you can already imagine how those teeth are going to fit in that small jaw. So if your jaw is nicely big and there's enough space for the tooth to come in, then it will come in normally. However, it also depends on the positioning of eruption. So sometimes when this tooth is growing, it doesn't grow straight like other teeth, so it might grow towards the other teeth. So then even if you have enough space, it will never come in because it's facing in the wrong position, okay? So when it comes to the nerve involvement, the lower molars, the lower wisdom teeth are mostly associated, or they might actually inflict or grow around the nerve that gives you the sensation to the lip and the tongue. So for the upper molars, then sometimes it grows inside the sinus or just at the floor of the sinus. Yeah.
Interesting. See, interesting. Right? Now, in the previous video, we also saw how important it is, taking care of, one's oral health and so on. What are some of the consequences that can occur if one is, if wisdom tooth, gets untreated, for instance? What are we looking at here?
Okay. So some of the consequences is pain, swelling, and also difficulties in chewing. And also sometimes when it's really bad, it can lead to cysts, some infections, and also it can lead to more other complications like we call it Ludwig's angina when there's an infection around there. So the infection spread into like inside the neck and then compress the airway, making it difficult to breathe. So that's why it's very important to keep up with the good oral hygiene, especially at the back of your teeth, so that there's no bacteria accumulating there. Yeah.
Oh, wow. Let's talk about the gums also. Some teeth can become trapped beneath the gums. Is that so, Dr. Awendo?
Yes. So we call that pericoronitis.
Sorry?
Pericoronitis. Okay, so when the wisdom tooth is trapped or impacted, as we say, it can be a bony impaction or a soft tissue impaction. So when it's a bony impaction, the tooth is totally covered by the bone, your jawbone. But then when it's partially erupted, you can still see part of it, but then the other part is covered by the gum. So now that forms a pocket. When you chew, the food then goes below the gum or inside the pocket there, and then it irritates the gum, and then the gum swells up, it becomes painful, sometimes pus even comes out there, bad breath and all that. Yeah.
Interesting. Now, Dr. Shiveva, adding on to what the other doctor just said now, you know, how does a modern diet, for instance, you know, influence jaw development or wisdom teeth or tooth eruption?
Okay, yeah. So modern diets, as I said earlier, they are soft compromise of soft food.
Soft foods.
Yes.
Soups?
Yes. Soups, fruits.
Fruits, yogurt.
They're soft. So back then, our people used to eat hard food. So they really made the jaws well developed and strong. But then now, nowadays, the jaws, mainly, most of them are small. And now the wisdom teeth are not fitting in the area, causing them to be compromised and we call it crowded when there's no space for them. So yeah.
Okay. Now, I think after extraction, let's also talk about that process. And this is probably a little bit, I don't want to say tricky, but not everybody sort of takes care after extraction.
Yeah.
You know, but what are some of the most complications that can occur after extraction when we're specifically talking about, you know, bone and gum tissue as well?
Okay. So when you're talking about wisdom teeth, we treat them as special teeth, okay? So the way we remove them is also special. Sometimes we mostly opt for surgical procedures. So you don't just come in and then we take a forceps and we take it out, because it's covered by the gum or covered by the bone. So we have to do some surgical part there. So when we remove the tooth now, like I said, if it's a lower molar, then sometimes it has nerve involvement. So when we remove the tooth, afterwards, you might feel a bit of numbness, which is just short term. It's supposed to resolve on its own. If not, we give you some supplements to help with that. And then there will also be a bit of swelling the following day for the next 3 days, because remember we did a surgical part. And then that swelling is supposed to subside for after 3 days, and then there will be pain, all because of the surgery. And then what else? Yeah, pain, swelling, and if you don't take it, and bleeding also. So these things are very normal, but we give you instructions to follow so they don't complicate further to become an infection. So what is important is that you bite on the gauze to stop the bleeding for 30 minutes.
You bite on what?
On the gauze, on the cotton band they give you.
Okay.
Yes, for 30 minutes.
30 minutes.
Yes.
Okay.
So that is just to stop the bleeding. And then you're not supposed to put your tongue there. You're not supposed to eat on that side. Otherwise, you're going to disturb the wound, and then the bleeding will come about again. Another thing is that the pain will mostly come about the following day or right after the anesthesia wears out. So that's why we advise you take your painkillers 30 minutes when you remove the cloth, just so you don't feel the transitioning. And then the swelling, we give you an ice pack just to put on around the face to put on the area so the swelling is not so big. And but then if you don't follow those instructions or you use a straw, we advise you don't use a straw also after surgery, because then that dislodges the blood clot that was supposed to be inside. We call it a socket where the tooth was. So now if you use a straw, then the blood clot comes out, or you put your tongue, blood clot comes out, or you smoke, the wound healing is also impaired. So now then you develop what we call dry socket. This is very, very painful. And most of the times, patients come to you complaining that you left a piece there. It's not a piece, it's just the bone that is exposed where the tooth was held. Okay, so now that we do the cleaning again, and then we give you the same instructions to follow. If you don't follow the same instructions, you still come back with the same
problem.
Yeah, with the same problem. Yeah. And then this infection can even spread to what Dr. Maria mentioned, Ludwig's angina or further complications.
Very interesting, hey? On a final note from the both of you, starting with you, Dr. Maria, you know, just what you want Namibians, what you want to leave Namibia with right now regarding wisdom teeth removal or just taking care, you know, when it comes to oral health in general.
Okay. So what I can say is wisdom teeth are not always necessary to remove, but make sure you visit your dentist to either rule out that you must remove or not. Yeah.
Yeah, thank you, doctor. I had all mine removed, just by the way. FYI.
Yes.
Doc?
Oh, yes.
Yes.
Yeah, I think it's very important. You cannot really say it's normal to keep them in or it's not normal to keep them in until you get an x-ray done. Like you said, you got your x-ray, and then that doctor will now take you through and see whether these teeth are to be kept or they'll bring you problems later, because they are like a ticking bomb. The problem, like pain, only comes after they've already done the destruction. Mostly they cause a decay on the edges and tooth, and this can only be picked up with an x-ray. So get an x-ray done and then discuss with your doctor to tell you whether you should remove them or not.
All right, do you want to add?
Yes, I want to add, and it's also very important for you to make sure you clean back there. I know it's very difficult maybe to reach there, but it's very important, especially with your floss.
By flossing.
Yes.
Yeah, it's true. I find it we don't floss a lot. Eh? We rely mostly just on the brush and maybe a bit of toothpicks here, there, and then we consider it done. But thank you very much for this insightful conversation, for taking us through every little thing. I think you guys covered all bases. It was nice having you.
Thank you.
for having us.
There you have it, Namibia. In studio with us here this morning is the real dentists, the real doctors, not Dr. Google that we often seem to run to first when we want answers. The real doctors here in studio, Dr. Maria Shiveva as well as Dr. Maneria Hawendo. They're both dentists speaking to us, and helping us understand wisdom teeth and the anatomy thereof and how we should be treating it. I hope you took away a lot from that conversation, as I have. We have got tons more to discuss after the very short break. Please stay with us.